Hi guys, for my week 3 clinical, my patient is 93 years old and cannot walk. She uses a Hoyer lift and is a 2-person assist. She uses a Broada chair for transportation and she's able to move her feet to walk around in the chair. She's also able to talk with you. She can have normal conversations, but she does have Alzheimer's disease, so sometimes the conversations can be a little confusing. She does like to eat a lot. She can eat herself. She doesn't use any assistive devices when she eats. From the last week of clinical that we were there in person with her, she had both pieces of her toast. She had 100% of her oatmeal, 100% of her orange juice, but didn't touch her eggs because she doesn't like any eggs. She is incontinent, so she needs to be changed with the 2-person assist in bed. She needs assistance rolling over because she can't do it on her own. She is alert and oriented times 3. Her last bowel movement was this morning, and then the vitals I took on my family member today, the pain was rated out of a 0 to 10 on a 0 to 10 scale. The blood pressure I took while they were sitting upright, it was 112/68, which is good blood pressure, normal range, on the left arm. And then when I took the pulse, it was in the left radial wrist. I got 72 beats per minute, and then the respiratory rate was normal, 16 beats per minute. It wasn't labored. And then the temperature was 97.6 degrees Fahrenheit, and I took that orally. When I assessed the respiratory system, I noticed eupnic breathing. There was no labored forces, and my patient had an erect posture. When auscultating the lung fields anteriorly and posteriorly, I heard normal lung sounds, no crackles, no bruits. And then with percussion anteriorly and posteriorly, there was no pain and there was resonance throughout. When assessing the cardiac system while listening to the heart sounds, S1 and S2 were present. There was no adventitious sounds. For the pulses, for radial pulses, I rated them a +2 equal strength bilaterally. For carotid pulses, they were +2 equal strength bilaterally. Posterior tibial I'd rate them a +1 equal strength bilaterally, a little weaker. And then for dorsalis pedis, +2 normal strength, equal bilaterally. And then the patient had no pitting edema in their lower extremities or by their ankles. And then for cap refill, their time in their hands were 2 seconds, which is an expected finding. It is less than 3 seconds, so it's normal. And then in the toes, it was 2 seconds too for cap refill, which is normal expected finding, less than 3 seconds. While assessing my patient's skin, I noticed that there was an even color throughout the skin for the upper and lower extremities, and there was no skin breakdown throughout the body that I could see. And then when assessing GI/GU, there was normal active bowel sounds throughout the 4 quadrants. Within the lower left quadrant, there was a little dullness with percussion. But other than that, there was no pain, and there was tympany throughout the other 3 quadrants. And then I didn't feel any masses, and with the hooking technique, I felt the outside border of the liver, which is an expected finding. When assessing neuro, I tested the range of motion on my patient. My patient was able to protract and retract her forehead against strength and without strength. And then for the upper extremity, my patient was able to adduct and abduct her arms to her body with and without strength, equal and bilaterally, and the patient was able to supinate and pronate both palms equal bilaterally with and without strength. And then for lower extremity, the patient was able to abduct and adduct the legs with and without strength, equal bilaterally, and the patient was able to plantar flex and dorsiflex both feet equally and bilaterally with and without strength. I assessed the sharp versus dull pain on my patient by using a paper clip and a cotton ball, and the patient was able to tell the difference between the sharp and dull pain on both the upper extremities and lower extremities equally and bilaterally. And like I said earlier, my patient is alert and oriented times 3, and while doing my physical assessment, I was able to see that the cranial nerves were all intact. And that's it for my patient for week 3 clinical assessment.